Hi class, my name is Jorge Salmeron, and this is my chart on vulnerable populations and the 6 risk factors that I identified. I'm going to start my presentation by defining what a health disparity is. According to Healthy People of 2020, they describe a health disparity as a particular type of health difference that is closely linked to socioeconomic and or environmental disadvantages. Health disparities adversely affect groups of individuals who have systematically experienced greater obstacles to health based on their racial or ethnic groups, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation or gender identity, geographic location, or other characteristics historically linked to discrimination or exclusion. One of the risk factors that I include, which is poor socioeconomic status, places these individuals at risk or they are vulnerable to poor health outcomes because, they might have difficulty assessing appropriate housing, appropriate nutrition. They might have limited education and maybe just poor access to healthcare. So this definitely makes this a significant risk factor as they might not be able to assess the appropriate healthcare that they require, or even healthcare just to promote their overall health. The next factor or risk factor that I chose was poor health literacy. It is known that higher levels of education allows individuals to gain more access to information and available resources in order to promote health. So individuals who do not have a significant health literacy or poor health literacy, they're at risk of not understanding what their diagnosis is. They might not understand what the procedures or steps that he or she needs to take in order to manage their chronic illness. And it just puts them in a vulnerable position where, their overall chronic illness may evolve and become worse and, have a decreased quality of life. Another risk factor that I chose was race or ethnicity. Many of these populations that are minorities have limited resources, at times live in high poverty neighborhoods, have language barriers, and have difficulty assessing healthcare. This can also include like the immigrant population who might not have health insurance, and that makes it very difficult for them to seek treatment if an injury or if they become ill. So this population is very vulnerable to poor health outcomes. Another risk factor that I chose was disability. Individuals with disabilities may have difficulty with accessibility. Maybe going to their doctor's appointments may be difficult because they don't have means of transporting their wheelchair, or the bus station might be far away and they're not able to attend their doctor's physician because maybe it's raining outside and they can't be out there in the rain. At times, disabled individuals may also be stereotyped and may be subjected to prejudice. These individuals, as we know, they are also very vulnerable, and because of their unfortunate disabilities, they may not be able to appropriately provide self-care for themselves. Another risk factor that I chose was gender. Studies have shown that there are health disparities between male and women in diagnosis and also treatment of health conditions. Also, because of cultural norms, women may have decreased access and less control over their healthcare resources. It's unfortunate that nowadays we still do have health disparity that includes gender. I think overall we've been doing a better job, and women are being allowed to have more healthcare resources, and it's just empowering them to seek those resources in the community and be able to get the adequate healthcare that they require is very important as well. The last risk factor that I chose is geographic location. This is a significant health disparity because in certain geographic areas, individuals may have difficulty accessing um, healthcare access, services, and might not even use the limited healthcare resources that are available to them. Also, depending on their geographic location, individuals who do live in a neighborhood that may be low income may also lack financial resources to attend a doctor's office, and might just avoid it in general just to avoid the cost. It could be like in rural areas where the closest hospital, the closest clinic may not be something that's too accessible for them because they might be an hour away, 45 minutes, and they might not have that transportation, as I had stated before. There's various ways where a geographic location can and is a health disparity and limits individuals to seek health care. And well, I think that's going to conclude the end of my presentation. I know it's a little bit fast, but thank you for your time.